Good morning, everyone. My name is Worawalan Chaibundit from Hat Yai Hospital, Thailand. Today, I would like to present about the research title, The Impact of Polypharmacy on Medication Adherence in Patients with Diabetic Mellitus Type 2 in rural Thailand. As we know that diabetes mellitus is a major common health issue worldwide, consistent medication adherence are crucial for therapeutics and prevent diabetes complications. However, diabetes patients frequently have coexisting conditions that requiring additional medication, so polypharmacy are common among diabetics patients and making adherence more difficult. The gap is previous study focused on target urban populations and neglect rural setting where socioeconomics and lifestyle factor uniquely affect adherence. So the aim is to assess the association between polypharmacy and medication adherence in type 2 DM patients of community hospital in rural areas, and to identify factors that influencing medication adherence in this population. The methodology. This is analytical cross-sectional study conducted at 3 community hospitals in rural area of southern Thailand, and 300 cases of type 2 DM were selected by systemic random sampling. Patients who cannot communicate in Thai psychiatric conditions and pregnancy were excluded. The method we use to collect data is paper-based questionnaire and Moresky medication adherence scales, or MMAS-8, and we have two main variables, which is poor medication adherence level when MMAS-8 is below 6 score, and polypharmacy level as patients who take medication more than 5 times. The statistical analysis we used descriptive analysis and logistic regression with generalized estimating equation or GEE. The results among 300 diabetes patients, mostly 69% were females and 31% were male. Median age was 64 years and occupation mostly 130 patients were unemployed. Figure 1 show the prevalence of poor medication adherence was 36%. That was lower than well medication adherence, and polypharmacy show an increased prevalence among diabetes patients that was 56%. Figure 2 shown the multivariable logistic regression analysis revealed that polypharmacy would not significantly associated with poor adherence, and significant predictors were of poor adherence include older age, male sex, and unemployed compared to agriculture. In discussion, the study found a high prevalence of polypharmacy in diabetes patients, but not significantly associated with medication adherence. Older age showed better adherence because of behavior regulations. Women demonstrated better adherence due to proactive health behavior, and unemployed patients exhibit better adherence, likely to more time at home and social support from family and healthcare providers. For conclusion, polypharmacy was not significantly associated with adherence in rural type 2 DM patients, while socioeconomic factors like occupation, age, and sex were key determinants. Target and demographic-specific interventions are needed to address barriers, improve adherence, and reduce diabetics-related complications in rural settings. Thank you for attention.
Do you have any comments or questions?
Thank you for a good presentation. Could you please tell me what is the implication for this study?
From the finding that age, sex, and occupation were determinant for key determinants, I think that next study should be our qualitative study to explore the reason why these factors are associated with polypharmacy. Or maybe have a community-based intervention like group counseling or medical review clinic or social supporting adherence to make these factors more better adherence.
I have another question about your interesting result regarding the significant factor of the unemployment, which reduce the medical adherence compared with the agriculture culture. So what would you suggest from these results?
Okay. From the previous study, found that em- employment compared to unemployed, that employed patients may rush to leave homes and they often forget to take their medications. Why employed patients, they have more time at home and have families and caregivers support them to take routine medications that make them better adherence.
So you suggest people who do the farming to like go unemployed to improve
Uh,
medical adherence?
That's why
You
the
think your
next
data
study,
may be inconsistent and probably need more research, more data collection?
again, please.
You think the result is correct, or you think there might be something to improve about the data collection or methodology? Both.
ตอบได้ใช่ไหมคะ about unemployed about the methodology to collect the data. I think that we limit by the self reporting and Mirsky scale. Oh, I think that we should have other two to access more details about this too.